Okay, good morning, everybody. Welcome to our May general meetings. And today we are going to discuss few things related to the medical mission. And I know this is exciting for the team Qhsc because we have so many people who are joining us for the first time on the meeting and are trying to learn as much as they can about the medical mission. And we want to make sure they are welcome to our Qhsc family. So to start with, my name is Dr. Harriet Gabon Siakabe, and I am so excited to be including everybody to go to Tanzania and provide this medical mission. And this, of course, medical mission is divided by two phases, and that's the school side, which is the community side, and then also for the hospital. And we have a lot of expertise on their own field who we're going to use their expertise either for community outreach or school side or the hospital side to be able to take care of these individuals in Tanzania. Tanzania is a beautiful place, very friendly place, and you are going to find out they're very, very welcoming, very, very happy people. And just a little bit of your presence, you see, you light their life. And so that's our goal, to go and inspire and support them and bless them with what we are blessed with. So Qhsc is, this is our fifth trip to go to Tanzania as a group. And as I said, we are so excited. To start with, I'm gonna let my vice president introduce himself, and then our one of our board members introduce herself, and then we continue throughout the group. So if everybody can come through the screen, that would be beautiful, so we can see your faces, even for a little bit. Okay, go ahead.
All right. I'll be very brief. My name is Parant KG Siakabe. I live in the state of Virginia, and I'll be working in the area of education. I'm not sure if I'll make it to the hospital or not. I usually try to take pictures and things like that, video and do interviews or whatever. But yeah, if I can, I hope to get to the hospital too. So, but that's it. I'm the assistant to Dr. Gabone Siakabe. And as I forgot to say, I'm Parant KG, but the G stands for Gaboni Siakabe.
Thank you. My mentees, Mrs. Bree Vargas, please go ahead.
Hello, my name is Bree. I'm over here in Hot, Florida. I'm a registered nurse. This will be my third year going to Tanzania for the medical mission, and I love it. Last year we started a CPR program, so I will be in charge of that, and then probably a little bit of postpartum hemorrhage and whatever else Dr. Gabon tells me to do.
Thank you. Okay, on my screen is Miss Roslyn. If you can introduce yourself, please.
Hi, I'm Roslyn, and I live in Brooklyn, New York. I'm retired. I've only made one trip to Africa, and that was on the West Coast. So I am very much looking forward to going on the East Coast, and visiting Tanzania, and also participating in volunteering in whether educational or medical side. Just looking forward to giving back.
Thank you very much. Next one is Veronica.
Good morning. I'm Veronica Johnson. I'm a retired educator. I taught adult education as well as young adults, 16 to 21-year-olds. I am so looking. I love mission trips, and I look forward to doing service in any way possible. And I'm complete. Thank you.
Thank you very much. Audrey.
Hey, I'm Audrey. I'm from New York. I am a holistic RN. I work now in the community. I've worked in the community for like 27 years. And I feel like all of my life I've been of service to my community. And so I want to take this beyond now, and it's my first mission, first time in Africa, first for me all around. Okay, so nice to meet everyone. And I'm looking forward. Have a great day. What am I doing? I'm ending my work Zooms.
That's okay. Thank you. Rukia on my left side, yes.
Hello, everyone. My name is Rakia Whitfield Brown, and I am also retired, and I'm so excited about this. I love service. I think that that's what we're born to do, is to serve. I'm a foster parent by nature and by choice, and a coach. And I'm just looking forward to be of service in any way that I can. Because I do believe in you get what you give. You pay it forward, life is reciprocal. And I am complete.
Thank you very much. Agape,
Hello everyone, I'm Agape. Actually, I'm a junior doctor born in Tanzania, and this is my first time to join you all here today. And I'm always excited to serve and be part of a solution to the communities. And I hope to learn to uh, interaction with all of you, and hope it's going to be fun reaching out to places that we plan to visit.
thank you very much. We are so excited that you are here. So he's going to help us quite a bit with all the doctors in the hospital. Definitely. Thank you.
Karibu sana, Agape. Karibu sana.
Sante, sante, sante.
Okay, Dr. Sharon.
Hi, I'm Dr. Patricia Sharon. I went to Tanzania with Dr. Gaboni and Parunk last year, and we had a great time. You guys don't be afraid. It's a very well organized trip. You know what you're doing every moment, every day. The hospitals received us very well. It was organized into piece everyone's capabilities, and I really thoroughly enjoyed myself. I'm sorry I won't be going this year, but maybe next year. Okay, thank you.
Thanks, Dr. Sharon. Mr. Steve Jones, Credit Commando.
The prayer warrior.
Yes, our prayer warriors.
Good morning, everyone. This is Steve Jones. This will be my fourth time going to Tanzania. It is an awesome opportunity for those who have not had an opportunity to go to see the countryside, the people, the food. I mean, to be able to lend a hand to wherever you can lend a hand in, the hospitals or the education, the schools. You're going to fall in love with the kids. I'm telling you right now, it's an awesome trip. Dr. Cabona have everything planned out for you. Believe me, just follow the rules and regulations she has set out before you, and you would have an awesome time. An awesome time. But believe me, it's work. It's going to be some work, but you'll be able to do it, but you're going to work. Hope to see you there. God bless.
Thank you. Be blessed yourself. Miss Tanya. Yay.
Good morning. I'm Tanya Rice. I'm an educator and a NICU nurse, and this will be my first time going. So I'm crossing my fingers and praying to the Lord that it all works out. And I hope to help however I can.
Yes, you will. That's okay. You can represent him. That's fine. Oh, Dr. Kimbi.
Is here as well, yes.
Okay.
My name is Henry Akimbi, and I used to work with Harriet, Dr. Gabon, way back when she was in Cincinnati. So that's my connection to this group. It will be my first time going on this trip, but I've been on a medical mission trip way back when my daughter was in college. I accompanied her to Panama on a medical mission trip. So, but this is all new for me, and I'm a pediatrician, and I've been in Cincinnati here for 30 years as a neonatologist. So I look forward to. It sounds like it's very exciting from all the testimonies, and it looks like it's a well-oiled machine, and so I'm looking forward to go with you this year. See how it goes. I've always been really interested in East Africa. I'm from West Africa, you could tell. I'm from Nigeria. So, but I've always been very, very interested in East Africa. I went to Kenya about maybe 40 years ago. I was in Kenya. So that's about it for me. My wife is close by, and she will tell you about herself.
Thank you, Dr. Kimbi. Mrs. Adina.
My name is Ahmed Akimbi. I am the wife of Dr. Akimbi. I'm a pharmacist by trade. My first time going on a trip. Looking forward to getting to know each and every one of you and learning all that I can.
Thank you very much. We are so excited. Yes, Dr. Kimby. Yes, it looks like everybody's enjoying themselves. But yeah, as Mr. Steve Jones said, we work hard, but then of course we have to replenish all our energy. And of course, we have to be a little bit acculturated with the environment. So appreciate what Tanzania can offer. And then of course, what we are giving them and what they're receiving. So thank you.
Good morning, everyone.
Good
My name
morning.
is Victoria Jones. I'm the wife of Steve Jones, the credit commando. I have been on the mission trip twice before. I started out as a burn specialist, and now I'm transitioning to a special education teacher. So I will be going under that, I guess, title.
Yes.
And hopefully doing whatever I can do on this mission trip.
Yeah, we have plenty planned for you. Exciting. And everybody
Yes,
will get to
yes.
experience that part. Yes, she is doing an excellent job with collaboration between the school, Daniel Webster from Dallas, Texas. They're collaborating with the schools in Minazini. That's one of the schools we are going to. So she was on this side organizing, and then of course the global volunteer from United States, from the Tanzania side, we collaborate and get the kids involved. So we have special things planned this time. So it's gonna be excited. I'm excited. But anyway, so thank you very much, guys, for coming. And we are really, really blessed to have you join us. And we are looking forward to go and bless others. I'm going to start the meeting today. Again, we are going to cover things that we need to do as of now. And then as we're getting ready to go to the medical mission. The more of those things you do early, the easier it's going to be. So you are less stressed out as we get close. Before I forget, and if you didn't get anything from this meeting today, make sure you have a passport that works at least 6 months. You have more like little space for them to stamp. Make sure you have those 6 months before it expired. So if not, you have to rush now, because I don't want to wait until in August and say you don't have a passport, and I don't want you to pay almost so much money to do like overnight or 4 days, which is be like $300 or $400. We don't want to need to do that, because right now, if you order now, it will be, I think, 11 weeks, which is close to 2 months. You're getting very close. So please make sure you have your passport. If you have any issues, please let us know so we can walk you through and get application done. Okay, so as I said, we are working for the 2024 medical mission to Tanzania. The dates are from the 13th to the 28th. Remember, it depends on where you're coming from. We might be leaving a little bit early or arriving a little bit later because of the flight connections. But our goal is to make sure everybody gets through Dubai, and then we arrive in Tanzania on the same day to make it easier for everybody else. So as you being here and showing your interest, and people have already bought their tickets, you are going to be part of the 2024 medical mission. So this is from last year. And as I said, I thank you guys for being here and appreciate your sacrifice and passion to pay forward. So today we're going to cover plans for 2024 medical mission, the timeline, payment for the local and international expenses, tips and preparation for the medical mission, accommodations, transportations, and fundraising for all those individual projects. We already discussed about the projects in a community size, you know, the nutrition, hydration, sports, vision, hand washing, sanitary pads. And then from the hospital part, we have Help Baby Breathe, which is the thermoregulation, and also postpartum hemorrhage, prevention of postpartum hemorrhage, and then ICU team, also we go there, and compression and ventilation, that's the CPR, which could be combined with a prevention of postpartum hemorrhage. And also we have the emergencies included in under the compression, and then the school collaboration, what we discussed a few minutes ago with Mrs. Victoria Jones. So I put this on the project managers and the people who are working in as of now, but we're still going to add more people. I'm going to start communicating with individual volunteers to make sure that you are included in those areas. And those sometimes could be fluid in a sense that if we get there, let's say one group is getting more people than the other, we can just try to share. Maybe today you might do this and tomorrow you can do that. But we will know that ahead of time. And we know, of course, sometimes emergencies happens. So we have to be a little bit more flexible. But I just put it in here like an overview. So to understand when we get close to, everybody's going to know where they're going. So you don't have to think about it. And then you usually share this schedule the night before. So definitely my husband will be running that updates. Like in the evening, we say, okay, this is a group going here and you're going here. You're going to take this today. You're going to take that part. So as I said, I put this in just in case to give you an idea of how things are divided to the last minute. So for the thermoregulation or help baby breathe, this is usually there in the hospitals. So Dr. Msamchak and Dr. Ngido have been running this project for the last 3 years now. They are still involved with this project because they've been offering the online training here through the Zoom. And then of course, they're gonna continue doing that. Even if we're not there, we're planning to have kind of like a lecture or discussion via Zoom while we are there and they're here to try and still continue what they've been doing so far. And Dr. Dorothy Wavrick and Dr. Kimbis and Mrs. Tanya Rice also, they are going to be involved in that area, but we're going to give you more details afterwards. So that usually group we do like doing rounds in the morning with the doctors and nurses over there, and then try to go through the unit and try and do those consultation and walk them through, try to help the nurse and doctors doing that. And I think Agape, sorry, I forgot your second name. The doctor from Tanzania also is going to be included in that group to help them, translate and walk them through to see how they process in Tanzania, how they do it. And also part of it, when they're doing those transition of those newborn, and also the thermoregulation is going to be included. So there are other people will be added in there, either they're non-healthcare workers or nurses. They will be included in there to work with them, to teach the moms who delivered those days and babies are brand new, to teach them how to keep the baby warm. So that's the thermoregulation part. And that's why we are collecting those T-shirts, onesies, blankets and stuff in that group. And that ICU and anesthesia, that's Dr. Gwen Randall. She's been running that project for like 4 years now, and she's continuing. She's going to be with us. I put there Mrs. Media Kimby there because she's a pharmacist to help us with when Dr. Gwen is teaching all those anesthesia in the ICU and of course medication and stuff, so she will be able to help and assist as much as she can. And those things, we'll be discussing even before we get there, and then so once we get there, it'll be more of like a consultation purposes and discussion what alternative they can use to try and help. And then so of course you're gonna see I put Mrs. Media Kimbe almost throughout everywhere there's any medical needs like medication and stuff. So for postpartum hemorrhage, when you're teaching, they'll definitely we do all those algorithm and medication that we use. Some of the medication are not available in Tanzania, so then she will help us to be able to find those alternative. We have had already discussion of what can be done and what medication they've been using, and that's just should be a consulting person to help us and bridge that gap. For pediatric cardiac, yes, Dr. Sharon has been doing that part. We're going to continue with that, but unfortunately, she's not going to be with us this year. However, still, we're going to use that consultation. We might arrange for her to do the presentation, even if it's from here, to be able to talk to the nurse and the doctors over there. Last year, she did an excellent job, 2 places, at the hospital and also at the magnet. So, and Dr. Dorothy Wavrick also is going to be included there, and Dr. Kim is going to be included in there. CPR, Mrs. Brevergus, definitely. Of course, that's what the emergency room, emergencies, they're going to be able to work with also with his Medi Akimbi to help with the drugs. We were working with the crash cart last year. We're going to continue try to gather some information before we get there, so to be able to help them as the patient comes in through the triage or emergency room. So what are the things that they should readily have them? Dr. Msambi Chaka did help last year with Breed to work to help, especially Kilwa Hospital, but we didn't do that in Mwananyamala. So we want to try to do that this year also. But we make the schedule so you know which day you're doing what, and then at what time you're doing those for the ER or emergency room, and then you go continue doing the CPR training. I add there Miss Audrey there to help us also there. But as I said, if I put your name there, we're going to walk you through it and then finalize by August to make sure which group you're going to be fit well. Sanitary pad, we did last year, that project, Ms. Tamasha Ngalombas, she's from Tanzania, was able to run that programs. And I added also Ms. Audrey to help her with that. we're going to add more people in there. So this is just, I said, an issue. Nutrition and hydration, Mrs. Christine Behoniak, she's an organizer. She's been doing that for all 5 medical missions. Unfortunately, this year, she's not going to be able to go with us, but we're praying that she will be well for help us next year to come back and continue that project. Dr. Paranka Siakabe is going to be working on that group, also supporting what needs to be done. And then Leah, Philip, she was help us last year, helping with the nutrition education. I'm going to add definitely Ms. Rukia and Ms. Rosalind to that group also to help with that. But as I said, we're going to walk you through. You're going to always have somebody who have done that before, so it's not so hard, but you'll be able to do that. CPR in athletes at Magnet, we know Bree does that, and Dr. Komakoma also is going to be included in there. And then for sports, we know Dr. Paranka Siakabe and Mr. B. Rice. Others who spoke, also people who are in school, we're going to add more people in there. You know, Mr. Steve Jones also was involved last year, so they know how to distribute themselves and feed up what it needs to be done. So I don't have to worry about that, but I know they are capable hands there. Visual acuity and reading glasses, definitely Mr. Steve Jones has been doing that with us for almost now 5 years going, and we are thankful for that. So this is going to be also, we still have the glasses in Tanzania, hoping we get to distribute them, but unfortunately we were not, because we didn't have the optometrists to go with us. However, we are still working on it to try and get at least people who can come and help us. But this is just the reading glasses. So we will continue doing that part to help the parents who were assessed or checked last year to make sure they get some reading glasses. And there's a lot of logistics needed there. Mr. Steve Jones, I'm sure he'll be happy to help and assist anybody who needs help when they're doing those logistic parts. School collaboration, that's the one I was talking about, Mrs. Victoria Jones. She's the one who is going to be organizing that collaboration, and we're going to try to do at least 1 or 2 communication with the Daniel Webster School during the medical mission, to us at least to help and see what it can be done from there, and then continue with communicating with the teachers. Since she's going to be at the school most of the time, they need to be able to happen. She was going to work with the teachers and see what they need there. And also she's working with the special care needs students, which the teachers are working to try and give us a list of the students who need the help the most, and what other screening things can be done. So there's more to come to that part. And if some of people, I know some people have worked in school district before, even if you're retired, we might be added to that group to be able to help along and work with the teachers in Tanzania. School supplies, definitely that project is continuous. Dr. Paranka Siakabe is doing that part, and Ms. Veronica Jones also, she's helping collecting all the supplies. Also, she's going to be in there to try and help us sort those things out and distribute through the school when the things arrive. Dental hygiene and hand washing. I have Lucy, she's been there for, maybe this will be her 4th medical mission. She's from Tanzania, and there's more people are going to be added. And I think Ms. Rukia also can be added to that group to try and help. So even if I didn't mention your name, the names are going to be added, because I started working on this list yesterday. So I know I still have more people. I need to talk to you guys to be able to see what exactly your passion is and which area can fit you, and you can help us to try and cover that area. But majority of the time, people can move from one to the next project without any problem, unless you're an expert in one area, then I will keep you in that area. But majority of the time, you will be able to get to that area, and you will know way before that. As I said, we start working right now, and I'm going to keep talking to individuals to make sure where I can fit you well, so you can get to enjoy what you do to those that area. Any questions before I continue? Going once, twice?
No questions.
Thank you. Okay, so since you decided to come, as I said, I know a couple of you guys have signed up through the website, so thank you very much. Just scan that code, and then it will take you to the website, and it tells you exactly what information is. Advantage of doing this way, because it's going to give me your address, your phone number and some information that you're interested to come to the medical mission. This also helped me to build up. So when I'm writing the invitation letter to the hospitals and the school in Tanzania, I have all the information I need to add the information to the letter, for the invitation letter. So we have all the information because we have to create kind of like a library for all the people who are going in there. When you're also doing the visa, I will have all the information in there because you're going to give me your information about the your address, your email, and complete and full name, the way it appears on your passport. Because when you're getting the invitation letter to get your visa, I want to get all the names. It has to match, because if it doesn't match, when you send it to the application on the visa, they may send it back. We don't want to avoid that. So that's why we create this form to make sure that you give me the name, the way it appears on your passport. So when I put it on invitation letters and we put an electronic information when we apply, it's going to be received when going to Tanzania. They scan the name have to match exactly it is how it is on your passport. And that's why I encourage you guys, just scan that part and then send that information to me. So then I have what information I need to start to continue prepare those things. Okay, you are going to fill out this information once you we receive the lead, what they call it, from the website. We're going to send you these forms for you to fill it. These forms will protect you, protect the hospital, protect the school, and protect the organization, in a sense that you do things according to what you're going to sign up to. Like, you cannot share information for your personal use. Let's say a child who is sick with whatever the diagnosis is and publicize it outside. So that will mean you'll be breaking that information. Or the child at school who is struggling, or maybe, I don't know, have one deficit, one eye or one leg, you take it and then post in Facebook for the entertainment purposes. You can't do that. So there's information that we put in this form. We want you to be able to read and sign it and send them to me so we can have it protected. And then, so the idea is to have things that, as I said, protect you as a person, so you know what boundaries you have, and then protect the children, especially we're working with the children who are vulnerable population. Also, you're working in the hospital, patients who are vulnerable population. Also, you have to have some boundaries. So there's a lot of stuff that we can get picture-wise, video-wise, and then I have to see what you have before you publicize, in a sense that if we're using those publications for fundraising to help them back to them, that is okay, but I still need to know that, and before you post it, I want to see it. So just in case, because when you post it, they see it's associated with the Qhsc, they're gonna come back to me and say, did you know that? But you know, like you're breaking the rule or something like that. So I will tell you, this is okay, this is not. Or if you're doing fundraising for the kids for the next mission, then yes. So we say, okay, yes, and then I will keep the record up, but just in case anything happens, you can say, yes, we follow the rules, we find the consent from the hospital, the school, or the parents of the child that you took a picture of, and then so to make sure that it's safe. So just put yourself in those situations. Do you want somebody to come in your house and start taking picture of you and then post it without consenting to you? That's not right. So those are things that we need to make sure and think between that to protect you, the patients, and people in the community, because we are going to take care of them. We are visitors to their environment, so we have to be respectful. Okay, so one of the areas that once you get your ticket, we are going to send this link to you where you can access the travel insurance. So the travel insurance, including the flights and your medical expenses when you are in Tanzania. And that also will cover the day that you leave from here and until the day you come back. So the form looks like this, and also when you see it, it says the trip cost. So where it says 0, you can put whatever you want the ticket cost. I don't know, 13, 14, or 15, or 1600, whatever you cost here. And then so select your destination, you say Tanzania, and then trip dates, wherever you're living. So the 13th and coming back, more like the 29 or 30. So if you are able to do that, or at the date that you'll be arriving back to America. And then select number of the travelers, so that'll be yourself, unless I know we have almost 4 couples. So if you're applying with you and your spouse, then you can put there 2 of them, but it's easier to do individually, so you can see it. And then your age, and then of course the residence, of course we know that, and then citizen, you know that. And then you said you get quote. So when you do the quote, it is gonna give you the the information that it's going to give you the price that you can do. So right now, yes, we make sure people have their tickets and the travel insurance. If you have any question, let me know so we can address that part. But the visa is going to be for the next meeting. So don't worry about the visa right now, but just make sure you get your ticket and their travel insurance. We're going to start from this today. We're going to start helping people to get the insurance. So when you go to the insurance, this is the one we used last year, 12 week. And then it's still recommended if you go for the international insurance. It's recommended. And the price is going to vary. Some people will be like from $25. Some people will be like $70 because it depends on what you are selecting up here. I will encourage you to make sure you have triple cancellation, triple interruption, medical evacuation, and emergency medical, definitely, and baggage loss. Those 5 of them, please select those ones to include that because that is going to cover you wherever you need. There's some people want flight accident or accidental death. Those are options. So the price is going to change from what you are adding. But as a group, I will encourage you to get the top 5 items. You can choose anywhere else. I've worked with Travic since we started the medical mission. So, and they've been very attentive in the sense like if you can call and ask them the question, somebody's there to answer the question. And that's what I want, just in case if we need to contact them in case of emergency, then at least you know somebody's going to respond. But there are some people swears about other insurances, but I've never worked with the other people, so I have no idea. But I've worked with Travic. Yes, Dr. Siakabe, you raise your hand.
I was just going to give everyone a reminder that this video will be posted on our YouTube page as well, so they can always go back and use it as a reference.
Okay, thank you. But yes, so then I said it's going to vary the amount, and that's why I put just a tentative for some of us. Yes, I think mine is like 53, 59 for the my insurance. Yeah, some people I know Bree's laughing at me, so probably she's like 25 or 20, whatever. So it depends on what you are putting information in there, so you're gonna get that. But as long as you cover those the first top 5 items, we're good. Okay, so for the ticket, so for example, mine was you're leaving from Florida, sorry, Miami, and then you go through the Dubai, and then of course going over there, the layover is 10 hours. I know it's a long hours, but usually we use that to revise review our schedules and make sure we are set. And some people, of course, love shopping in Dubai, so that's okay. You can do that. And some people want to sleep. That's fine also. So, but then we're going to arrive in Dar es Salaam on the 14th at 1:55, so almost 2 o'clock, and then in the afternoon, which is great because when we get there and then get settled, we have the time at least to take a shower, eat something, and take a nap and sleep, and then before dinner time when we come to eat dinner again. So at least you can try and synchronize your hours because Tanzania is 7 hours ahead. So like right now, we are talking right now, it's 9:39, so plus 7 hours is gonna be 4 in the afternoon. 4 in the evening. We're gonna have some people have jet lag. We encourage make sure that before you take off, you can try and stay as much as awake as you can, so you can sleep in the flight. So then those 11 hours flight will change the hours. At least when you wake up in Dubai, you are synchronized your hours with Tanzanian time. But some people say they can't sleep in the plane. But so try to do as much as you can and sleep through especially the first leg of the flight. So then you synchronize your sleeping time, because otherwise you're going to struggle. People who work at night, they do very well because they're always awake at night. Here in the United States, that means that's during the day in Tanzania. So there's a lot of little tricks people do it. And you start hearing those things through our communication when people start sharing their previous experience and what they did to help them survive those long hours flight. But it's a lot of entertainment in there. You can do a lot of stuff during the flight. So you're not going to be bored, but you get entertained. So for me, so the initial people who are buying the tickets, the average was like $13.50. And then there's some people who are going almost $14.50, depends on where you're coming from. As I said, for me, it was from Miami. But other people from New York, or some people from Virginia, I think it was like 12 something or 13 something. And then some people are from other places like 15 or 16. So Dallas, I think, is different because it depends on where you're connecting your flights. And as I said, it's great if you can talk to Nobel and then make sure you, I mean, he knows how to connect you and see which flight you should be getting into so we can arrive at the same time. We already said before, in case of something happens and then your flight maybe does not reach in time for us to leave with you, that's okay. As long as the arrangements are done, we'll be able to get you somebody to receive you in Tanzania. So don't start worried about, oh my goodness, how am I going to do if my flight was canceled or delayed or something like that. But we will make arrangements. And then, of course, we have a way of communicating with us and with the agency while we are traveling. So at least if there's any issues, we can address as we go. So you don't feel stranded.
Excuse me, Dr. Kabane, can I ask a question?
Yes, go ahead.
So is it preferable to leave, to schedule your flight like we're from Dallas in the morning? And I'm just asking for school purposes. Or can I schedule it late at night?
Oh, for the
to
class?
leave? No, just to leave so that I'm just trying to coordinate with whether I need to take off that Friday.
Yeah, because we are leaving at Friday early in the morning. So chances
Okay.
is, yeah, so, but Nobel will know which flight you, we make sure you are getting to Dallas, sorry, to Dubai with us.
Mm-hmm.
Yeah, so he will figure out which flight you need to take from Dallas to be able to get to Dubai and then join us there.
Okay, so just plan on taking a day off anyways.
Yeah, so if you talk to him, he should be able to explain and give you more options, because I know some other places it depends with where you live. Because remember, I said for people from Miami, unfortunately, we don't have, like a flight that leaves in the evening, which could have been okay because you see, remember, we have a very long layover for 10 hours.
Mm-hmm.
So
Okay.
if our flight maybe left at around 3 in the evening here, we still could have made that connection. However, there's no Emirates that leaves from Miami that late. It's only one early in the morning. And then it was a cheaper one that way. So from Dallas, it might be another flight. I know probably from New York and other JFK, not JFK, yeah, JFK people, or the Dallas or DC, they leave in the evening because their flight, their layover is like 2 hours. So they leave later during the day on the 13th. So those are people who don't need to take a time off on that day. Does that make sense?
Okay. It does.
Okay.
Yeah, Dr.
Okay, thank
Gaboni,
you.
Yes.
talking about the flights, I looked at that the other day, had someone
Yes.
do some review on the flights for me. And the flight that they gave me did not go into Dubai. It basically went back to either Istanbul or Doha, like we did the first time. So you're trying to get everybody to go into Dubai and meet there. But from Dallas, the flights are different.
Yes, I agree. And as I said, he will find an alternative to help you to get there. Because I said, I don't see what he sees. But yes, so if there's no Emirates from Dubai at that time that is going to connect, then he might find the Qatar. Because if you said you went to Istanbul, probably he's looking for Turkish airline. So if he's using the Turkish airline, yes, it's going to take you to Istanbul and then connect to Dar es Salaam. So if we arrive on the same day around that time, it's fine as long as it gets to the same day around the same time, so we can make sure we get all, we receive you and all the reception from the airport to the hotel is around the same time. It is okay. So Emirates was one of the options, but it worked for the people from Miami. But you can use a different airline. So if you use a different airline, it's not going to go to Dubai. It's going to go to
Right.
you said Istanbul, as the Turkish airline, I think, go to Istanbul. Qatar goes to not Dubai. Doha, yes. Yes. Yeah, that's it. He will find an alternative as long as he gets you around that time to Tanzania.
Okay. I just talked to Noble. That's what we're going through this year, right?
Yes, it's the same guy. Yes.
Okay. Thank you.
You're welcome. Okay, no, thank you for those questions. So the medical logistics. So this one is just a summary, but I have a document almost like it's 13 pages. I'm going to show you in a few minutes. I'm not going to review all of it, but I'm going to send it to the email. And that's why when you register to that website, you give me the information, I will get your email, and then I will send all these documents to you, so you have an actual electronic copy of all this information, so you have something to review with you. But this is the summary of what the expectation and logistic things will be happening in Tanzania. So we know for sure when you commit, the $250 is a non-refundable deposit, but some people wants to pay the whole thing, the $1,590, that $250 is included in there. So something happens later on and you're not going to be able to go, we can refund you before the time. I'll give you later the time. But the $250 is going to be non-refundable, because as soon as you commit, I have to clear space or save a space in Tanzania for you, like logistic ones, transportation wise, the safari, all those things, I have to lock them down now for you. So if you change your mind, then I'm left to pay for that deficit. And that's why we keep the 250. But if you are going, the 250 is included already in the 1590. So for individual people, for the logistical part, it's 1590 as a single person. For the people who are couple, there's a discount there, because when you go to the safari, you guys are sharing the room. So then you're going to get less much. I think it's like $50 less or something like that. So that is an option for other individuals, even if you are a single person. When I say single person, like an individual person going over there, and when you go to the safari, you want to share a room with another friend, then let me know. So then your budget is going to be changed, get that discount amount. But if you want to go and just stay by yourself in your individual room when you go to the safari, so the amount total is going to come to $1,590 as an individual person. So when we go through, once you pay the $1,590, we go to shopping and stuff. The shopping is going to be extra. It's not included in that part. So unless you want to do a souvenir for your family or your present when you're coming back, that's on your own. Or you want to buy something for yourself, extras, that's fine. Accommodation, meals, and transportation is included in that $1,590. Stays, we're going to stay as a group at the Dimaji Hotel. Usually this hotel, I'm going to share with you the pictures and stuff in August right now. We do have it right now, but we have not paid the down payment yet, because we're still collecting people enough to know how many people are going in there. But we have an understanding with the manager from there, because we stayed there last year. And it was a decent place, a safe place for us to make sure that we get a good place to eat and a safe place to stay. And then, of course, the normal length of workday can vary, depends if you're at school, in your community, or at the hospital. So in a hospital, definitely, we're going to be leaving early to try and catch the change of shift or rounding, which starts at 7 o'clock. So thank God one of the hospitals is close to the hotel, and the other one is a little bit away. So we still have to drive over there. And then start at 6 in the morning. So then ends maybe by the time we finish that, it's going to be around 5. And we know people who work in the hospital, sometimes they say in labor and delivery, they're delivering the babies there, or they have an emergency resuscitating the babies. We're not going to walk away and say, oops, it's 5 o'clock, I'm leaving. No, we're going to stay there and help them and support them as much as we can by guiding or consulting with them what things could be done or should be done at that situation. But other than that, more likely by 5, we should be coming back to the hotel. And then people at school, you're not starting this day that early, more like it's going to be around 8, but leaving from the hotel will be around 7. So that means breakfast, usually it's like around that 6 o'clock, we eat breakfast and then we go. So, but usually they save for us between 6 and 8, because people who are going to school are going to eat a little bit later, or people who are going to do the community project that day is going to be a little bit later. So that's why they have an opening time for us. And they know how many people are staying there. They know, they're going to know us because we're going to be walking around with our T-shirts and badges. So they know you belong to the Qhsc and your breakfast is included with your accommodation there. And then, of course, the global volunteer safety. So a lot of stuff we are going to do in a group. So I know sometimes the people be like, oh, can I go shopping while it's during the day? We don't do that. So we save the shopping on a specific day that I know we can assign people from our global volunteer from Tanzania to go with you, so you are safe. Because you don't know the language or you don't know the places that is safe for shopping, I usually prefer you not to go by yourself. So you wait until you go maybe 4 or 5 in a group with one of the person from Tanzania, so they can talk to and walk you through and make sure you are safe going and safe coming back. And then, of course, the language that is spoken there is Swahili. So, and I know people are learning Swahili through the Duolingo. So remember, if you go some official places, they do speak some English. It might not be a conversational English. It might be, like instructional English. Means they can understand what you are saying. They might not be able to, explain something in details in Swahili, in English. So, but they will try to give you instruction. What are things to do? Let's go to eat or do this here, or you're looking for somebody from here. So there we try to pair you with people who are going to be with us, so at least you have a support person everywhere you go. But sometimes, just in case if you're by yourself somewhere, so maybe you went to the restroom by yourself and then you want to come back, you get lost. There's those few little Swahili words that you can learn to help you just say toilet or drink, or you want something to drink. But we try to supply water for everybody, so you don't just go and drink from the fountain or from the water tap, because we want to make sure you are safe. So we always buy the water bottles and give it to you in the morning. You leave with the water bottle, and then all the meals we supply waters, and then even dinner you have water with you to eat, drink. So we don't encourage you to buy stuff from vendors or wherever you see them, because the people in Tanzania, they're used to that, but you are not. So yeah, we don't want you to get sick, have a stomach ache or something like that. So those are explanation for that. Oh, first of all, any questions about this part?
I got my hand raised.
Oh, I didn't see, it didn't show up here. So yes, go for it.
I was going to say that with the Duolingo, that a little bit of Swahili can go a long way in terms of how you're received with either the students or the staff at the school or the hospital, patients, anyone. You don't have to be an expert at it, but if you know how to say good morning or how are you, or like habari gani or something like that, it's well received, and it will go a long way. And then if you are on Duolingo and you're doing Swahili, or you're working on a second language or anything like that, there are a few of us that are already on there. So if you can, just let me know, and I'll make sure that everyone from the group follows you as well on Duolingo, so we can continue to support each other and push each other, so that we can learn a little more. Thank you.
Thank you.
Tanya has her hand up, Dr. Gabon.
Yes, go ahead.
Quick questions about the safari. Is the safari based out of a hotel, or is it like a camping type setup?
No, the safari is, we're going to what they call in Tanzania a national park. So you're going to see live animals. So we're gonna go almost like 6 hours from the hotel. Everything is included in your 1590. So from the hotel on Friday morning, we're gonna be traveling, and afternoon or early evening, we're gonna arrive to the city, which is called Morogoro. And then so we're gonna go to the national park. So there's kind of things that we are going to do. I can't tell you right now until you're in there. It's a surprise. And then the next morning we go to the national park, which you go the whole day. We spend it in the national park, seeing different animals and stuff, and then spend the night there. And then the next morning we come back to the hotel. So
Okay,
it's like going to, like Lady V, can you describe last time the way you were dressed up, like you're going to the national park? She had a hat and, like the skin.
Like Indiana Jones or
yes.
Tomb Raiders.
Yes.
I think Tanya's thinking that we're going to be camping. Some of these places do have tents and stuff like that, but you will let Lady V describe her accommodations.
Yes. Is she there?
Yes, she is, but maybe she stepped away. Not sure.
No, but that's what she called, yeah, like Indiana Jones. She has the hat covering, she has the skin protectants, you know, like, because you're gonna be outside. You wear long sleeve shirts to protect your skin because you are going outside where the animals are. We're gonna be renting the travel guide tracks and something like that. So it would definitely be like on the safari. You stand up and see the animal, take pictures and stuff the whole day, and then come back in the evening, rest, and then return back to Dar es Salaam.
Oh, this is
I think what they
Victoria.
were trying to say is basically you're gonna have a sun hat, some sunscreen, a
Yes.
long sleeve shirt, some maybe hiking boots. You don't want to wear no flats, and you may want to have some bug spray because there might be some bugs out there. So you just kind of protect yourself from the elements and from
Yes.
the insects. Okay, basically that's what she's saying.
Yes. Thank you.
All right, no problem. I just want to know what to throw in there.
Yes. Yes. And thank God because we are checking in the one of the bag, then yes, you can put all those things from here and pack and make sure everything is protective. Because we don't expect to go and buy the sunscreen from there. Because remember, the people in Tanzania, they enjoy their sun. They don't have to worry about it. But yes, so for us, we have to put that protective, because otherwise the scan by the end of the day, it's a direct, remember, if you know the geography, Tanzania is on the equator. So that's the direct heat, direct sun. So if you don't cover your skin, you stay outside the whole day, you're going to get, your skin is going to break. And usually, in fact, like last year, a lot of global volunteer bought hats to protect you, especially people who are in school playing sports outside. I said the kids would love it, and they don't even have to worry about it running around. They're used to it, but your skin is going to start breaking out because of the sun. So protecting the skin is a huge thing we need to do.
And then Victoria, do you remember your accommodations when we went on the safari?
Yeah. Accommodations like how?
Like where we stayed?
Oh, we were at the hotel, right? I don't know. I can't remember.
No, it was a hotel. Like I think you're talking about the 2 years when 2 years ago, 2022, when she went and we were in 2021 when we went and we were in the hotel. So the hotel is nice, but they call camping, but it's not like what American call camping. When they say camping, this is like a lodge in the middle of nowhere. The fancy ones, you still have protective walls and lights and all the stuff. It's still there, but when they said camping is not the same as the camping in Tanzania, in America, getting in the tent outside and putting sleep on the ground. No, it's not. So for them, still, it's kind of like a hotel, but in the middle of nowhere, like it's protected, and so the animal can come and find us.
Yeah, it's like a bungalow style, with the pathways and
or logs, yeah.
yeah, all that stuff like that. Yeah. So.
Excellent. All right. Thank you.
You're welcome. Thanks, Tanya.
Tanya, just don't be afraid. You'll be safe.
Yeah, you're going to be safe, and you're going to have food, and how good it's going to be. You're going to have a TV in the room, so you're not like Kathy. Okay, TV in the bathroom, in the shower. You may not have air conditioning, but you might have a fan. Okay, so you're going to be safe. All right.
And Tanya, don't worry. When you get to the safari, they will take a copy, or they'll take your passport information just in case the animals decide to attack.
That's me.
just want you to know.
Just in case of lying. I'm eating by lying.
Just in case.
Okay.
No, but I mean, so far we have had no drama, only excitement, definitely, only excitement. I can't wait. I'm so excited because the last time we went to the safari was 2021. So it was good. It was good. But this one is even better than that one. So I can't wait. Okay, so let me finish up and then we can let more discussion. So good news, we have collected a lot of supplies to send to Tanzania. So yes, we had our deadline on the April 30th, and then we were able to do the first shipment was sent May 6th. And then yesterday I got a word from the agency saying that tentative arrival will be in July 15th. So thank Jesus that this year, at least our first shipment, we arrived before we get there. So that means we're going to have stuff with us when we're going to work. Last year, the shipment was late, so we had to do like makeshift things. And it was, I mean, it was still doable, but we would have loved to have all these things before we arrive over there. But this year, at least the things that we sent, we have them in that shipment is going to arrive at ECB around July 15. And we know sometimes when you get the cargo at the port, it might take a little bit longer, but at least we have at least a month and a half before we get there. So chances it will be there when we arrive. So the second shipment is thankful Ms. Veronica for doing this. She is going to be helping us collecting stuff and send the stuff to New York. And then there's another person who is going to help us ship those things to Tanzania. So I'm hoping those things also will arrive before we get there so we can have use it during our medical mission. Some of the things that she was saying, we can do those baby blankets or onesies, the thermoregulation stuff. People have stuff like a postpartum hemorrhage. Yes, sure, if you can, if you want to order something now and send it to New York, so let me know. I will give you the address to send it to New York, but it has to arrive there by 5:14 because the shipment is like 5:15. So we really need your help. If you can send anything else, the things that we are still looking for is the notebook, still the baby blankets and onesies and cloth diapers. The regular diapers are fine, but the problem is they have to throw it away. And then, of course, it's not good for the environment. However, if that's the only thing that you can still buy from the store, we give them at least maybe one or two for those moms, and then they can use it maybe if they're going to church or going somewhere else, that they don't have to use the cloth diaper. Because remember, the cloth diaper are going to get wet. So if mom has one disposable in which she can use for the babies and then survive that length of time, then whatever. So we are accepting anything, but it has to arrive in New York by the 5:14. So if you guys can do that, that we appreciate. If you have any questions, let me know. Or if you have any question for Miss Veronica, then yes, we can transfer you and connect you to Veronica so then she can give you more details. But as of now, we really need your help. And then so we can send those things by the 5:14. You can order stuff from Amazon and then I can give you the address and then it can be shipped direct to that address. And then we have it and added it to the shipment and then send it to Tanzania. So I want to thank people who have already donated and are going to donate because without you, we won't be able to do all these things to and give these donations to people in Tanzania. So thank you, thank you, thank you. And you'll be blessed always. So we were hoping that if we are able to get more stuff, if let's say we get a bigger donation or something like that, if we can do it before the 30th, then if it's guaranteed that we do before end of August, then we might be able to collect more stuff. However, this is still open for discussion. So we have to wait until the July 15 date is confirmed. And then we can say, okay, sure, that we will be able to collect another shipment. However, if you get in touch with somebody who is wants to donate more stuff, or they are inspired from your interest going to the medical mission, and they have things, and we can still collect them. And then if we're not able to ship this year, we'll be able to collect and then send it in another time, even if we are not there. So there's a lot of stuff that we can still collect and send. We don't have to be there to distribute because we have the team from Tanzania to who can help us to distribute, even if the global volunteers are not there. So there's a lot of stuff going on. And I know there's one person who was talking to me yesterday, and they were saying that they're talking to somebody who may have something to give us, which is going to be a bigger shipment. Can they give us so we can ship it now? The answer is yes. So even if we are not there, we still have people in Tanzania who can help us with this shipment and delivery. So any donation is welcome. And some people wants to give money, that's even better, so we can order stuff and send it as fast as we can. Okay, so in summary for all this part, definitely give your passport now. And then the $250 definitely when you're confirming. And then the flights, as I said, it ranges between 12 and 17. It depends on which airline you're using. And then travel insurance, the amount is dependent on your flight insurance and your selections. And then invitation visa, I'm going to work on you as soon as you are already getting the tickets and finish the information so I can have your full name, the way it appears on your passport. I'm going to start sending it to Tanzania for those areas so you can get permission to the hospital and the school and the community to be able to get your invitation letter. And then, of course, the visa is going to be $100. We're going to be discussing about the visa process next meeting, which will be June 22nd. And then now we encourage you to get in touch with your primary physician and then about your vaccines and anti-malaria medication. And the medications are according to the CDC. So we will send you the document that has all the medication, just screenshot and send it to your doctor or your nurse practitioner or whoever is taking care of you and say, look, I'm going to the medical mission to Tanzania. They can go on the website and find exactly the same information. So then they will give you medication you need to take with you. I know sometimes people always ask you, what should we pack? Yes. So we always encourage you to put like lots of scrubs of dark colors. So navy blue, black, or gray is very different, unless it's like a dark gray, that's fine. The reason we want those dark colors because they don't get dirty that easily, because it's gonna be dust. When you go outside, it's an open road. So stepping or walking, yes. Avoid wear white shoes. Definitely white shoes are not going to work because they're gonna get dirty as soon as you can, even before you leave the hotel. So dark color shoes, covered shoes are preferred and recommended because of course the road might be rough that you're walking onto. So you want to make sure you have comfortable walking shoes. Sneakers works just fine. And then of course, as I said, the accommodation, transportation, safari, the expenses, all those expenses are due July 20th because members said I still have to pay for the reservation and stuff. And then those are the time the closer you get, they want you to pay because they want to make others. If we don't pay, then they will take the place and give it to somebody else. And then of course, for the electricity devices. So if you're planning to buy something specific to take it with you to Tanzania, just be aware of the voltage. I mean, so for America, they use 110 to 120, but for Tanzania is 220 to 240 volts. And then some of the items, if for the international use, then you can use, I mean, you buy the device that can be, with a switch, you can change it from US voltage to Tanzanian voltage, or European voltage. So those are the things, some of information, but I said, I'm gonna send, this document is like 13 pages. I'm gonna send it to you. There's more details in there to help you. So you have that reference. So I will send a group email which will come to you individually with all this information. I'm letting you know, so then at least you have a reference with you. Okay, to finish up with from my side.
We got a hand rose and
You had a question?
Yes.
Were you recommending the hepatitis A vaccine for the trip?
Yes.
Okay.
Yes.
Besides the malaria and the
yes.
yellow fever.
Yes. So then for the script that is going to be included in that document I'm going to send, it tells you, yes, so hepatitis A, definitely the hepatitis A is because of the food. So we want to make sure, even if the place that we are eating, they're going to be already screened, because I always talk to people and make sure that we're selecting places that they're safe, even the hospital, or even the restaurant we decide to go, and make sure that those are safer. However, some people's stomach may not react the same as others. And that's why we encourage you to do the hepatitis A. So they do wash the food, they do wash the fruits, but still you never know, things could be not as clean as it should be. But you're not going to know until somebody starts getting sick. So to prevent that, we take hepatitis A. Everybody who's taken hepatitis A, I've taken twice, because I think after 5 years, you have to repeat another dose. But yeah, so hepatitis A, definitely I will encourage you to have. We used to say the COVID vaccine is mandatory. That time you have to travel, you cannot travel without it. But right now it becomes just strongly recommended, not mandatory. That's the same thing our CDC is going to tell you. the idea is, especially if you're going to the hospital, they don't screen for the COVID. So it is your discretion to make sure that you are keeping yourself safe. We try, if we're going to the hospital, we try to wear the gloves and mask as much as we can, especially if you don't know what the patient might have. And sometimes they don't have isolation rooms. So sometimes they will mix patients in that unit, and they'll say, we don't know. So anytime you are suspicious or you are worried about maybe the child or the person is coughing too much, put on your mask. It is okay. They know that, and I already told them that if our global volunteer are concerned or worried or trying to screen patients, we're going to put the mask on. That is because we want to protect ourselves and protect you. Because remember, we are meeting for the first time. We have no idea what I travel all over the places. I don't know where I went through. I don't want to breathe something to them when they're already vulnerable. So they're aware of that. If the volunteers are wearing the mask, it says, okay, if you are trying to touch the patients, just make sure, think of the standard that you will use in America, but use what resources you have to make sure you protect yourself. So yes, you can go to them with the patient has enough fluid, bodily fluid. Please don't touch it just because everybody else is touching it. Protect yourself, put on your gloves. We usually give the gloves, distribute the gloves for individuals who are going to the hospital. You have maybe like 10 pairs in your pocket, and then you have the sanitizer with you. Please follow those guidelines that if you are in America, to protect yourself. Don't just do because, oh, they're going to see me, I look different. No, your safety and your health is important to you and to me. Right. I want to make sure I go with you, your health, and I come back with you, your health. So yes, we do that. And if we have some of the mask and shield, if you feel like, okay, this is the place that you do need to have to wear the shield, definitely we have some of them just stand by with us to make sure that, okay, put it on. Because taking care of the patient is our goal. And of course, offering consultation is our goal for our medical mission. So if the patient is sick and you feel you need to add more layers of protection, the PPE, please do. And then go and offer your services or support or expertise.
Yeah, I was going to add, I'm drawing a blank, Dr. Gaboni, but I don't use the chloroquine anti-malarials because it's not recommended for me. I use the antibiotic? Do you remember the name of it? It works really well.
The Doxy?
Yeah, doxycycline. That's right. Yes. Yes. So that's what I use for malaria is the doxycycline. And I haven't had any issues with it. And I think that one, is it like 5 days before you start taking it, I think?
I think you take that every day. I think I have my I'm gonna pull that full document once I finish this. This is the last page, I think. And then yes, and then I pull all the medication. Thank you for that question. So yeah, let me finish this one. I think it's the budget. So when I'm talking to you, I'm gonna send you the individual budget of what it is. You can see here there's the 540 and 465. So people who are individual people, we pay the 540. And then the couples, we pay each the 465. And that's what I said is the price changes. It depends if you are sharing a room or you are individuals. So that's why for the couples, you see your total amount is less than 1592 because you're getting discount by sharing a room with your spouse. But the individual people, they'll pay that. So that's the difference from all the budget. And I said, individually, I can talk to you to explain what exactly it is. So the first 3 lines here are yours because you get your ticket. This is just an example. The ticket, it depends on whatever the amount you pay. The visa is everybody pays $100. The insurance, it depends on what you are covering and selecting there. So it might change, as I said, 25 to 90, I think, depends. And then the rest of the part, we're all similar things, but the difference is just going to the safari. And then the transportation, everybody pays $100 for transportation. So it's covered all the 2 weeks.
And then just a quick one too. So any extras that you order, let's say you decide, oh, you know what, I'm a little hungry here at the safari and I want to order an extra, steak dinner or something like that. That's not covered in the initial cost. Same thing with like laundry service, things like that or whatever. So just remember, if you ask for any of these extra things and stuff like that. We're covering the things like we are itemized there, but anything outside of that, we don't, because what happens is sometimes people will order things or do things, and then they're going to come to Dr. Gaboni and they're going to ask her to pay. They're not going to give you anything for free. So.
No, thank you for raising a couple of things there. So definitely on that hotel, we are staying some of the days that maybe we come back early, they do have a swimming pool. So some people likes ice cream. So they do offer those ice cream. So those are not included on the amount that I will be paying for you for breakfast, lunch, and dinner. So the lunch when we are offered is like a buffet. So those ones is covered with your $15.90. But in between, if you buy alcohol, that's on your own. If you buy ice cream in between, that's on your own. Or some people likes mocha, latte, or whatever. In between the time, that is yours because it's not covered into the group. If there's something that you ate in between and then you like it, and if you then let me know during the menu, I can include it for the ones that I'm paying for everybody. I can include it in there, so then at least you get something that you wanted added in the menu. So, but we make an arrangement ahead of time. We try to find the food that appetize for everybody, not the fancy, not too spicy to isolate other people. I do need to know if you have allergies to the food, because I will tell them to cook that food separate, because we have had somebody with a gluten-free diet, which that was 2 medical mission back, yes. And they were able to do that and separate and cook that food for that individual separate. And then we never had any issues. I think only one time when we went out and then that individual tested something which we did not know that has gluten in there. And then, but she handled it very well, and then it was taken care of. But at the hotel, we never had any issues because we told them ahead of time, and the food was prepared separated from everybody else. We do have vegetarians in the group, so we have had no issues with that because the hotel has created menu that include a lot of vegetables. And in fact, if you notice, you will notice that Tanzanian menus, almost half of it is just vegetables. So, and then everything is freshly cooked. They don't have like freezing stuff. So everything is freshly cooked. So it's easier to separate things so we don't get any contamination. So that one, yeah, thank you for reminding me with that. And the other thing is laundry. So the laundry service is there, but that is on your own extras, because we are going to have your t-shirts and scrubs to wear, and some people wants to wash them in between, which is okay. So the laundry service is there. If you give your clothes like maybe today, then you get them tomorrow morning. Or if you take tomorrow in the morning, early in the morning before we leave, then at the end of the day, you might find them back in your room. And then they've already been washed. So just be aware of, they do have a list. Usually that's the August meeting. I'll give you the list of all how they itemize shirt, pants or dress or t-shirts or scrubs or lab coat. And then also even underwear. So even socks. So they itemize things, and then they will show you how much it is. And then you'll be able to pay for it. So if you want something washed, then yes, you wash. And then for the hotel, they clean the rooms every day. And then they do change the towels every day. And then, but if you don't want them to go in your room certain days, you can tell them so they don't have to go in there. That's okay. But they usually wants to come and clean and give you fresh towels and do the change the beddings. And then every bed has a mosquito net. So we are covered that way. Some people use it, some people don't. You might have the room with I mean, the air condition is there, so all the time. And then also they have a Wi-Fi, but we all know public Wi-Fi, it might not be as strong. The advantage you might have is at nighttime, because here in America, it's gonna be daytime. So you might have less people using the Wi-Fi. So that might be an advantage, but we all know the public Wi-Fi is not the strongest, but still you can use and people are able to use that. But Mr. Steve Jones, do you have any issues that last year using the Wi-Fi, or Mr. Siakabe?
No, I think last year was the best year. The year that we went to Dodoma, that one was a little trickier because they actually count the data that's being used, not for the individual, but for the hotel. So they'll have they talk about rolling blackouts for electricity. Well, they had rolling blackouts for data. So you come back to the hotel and they'd be like, oh, the data's off for the next 2 hours or something like that. So, but no, these last two hotels,
Yeah.
the DMAG where we're staying now, and then the Luther House, that it was pretty good. And I think the DMAG was definitely better than the Luther House as well. So
Okay, good.
Yeah,
So,
I think so. The DMAG was a little bit better. Although
okay,
you are gonna have some times where you can't connect, but that's gonna be very little. The Wi-Fi is on 24 hours, 24/7. That's the best part. So I found out that kind of like late at night you get a little bit stronger. And then
yeah.
it depends on where your room is. You might have to, move around a little bit, but you do have Wi-Fi. That's the best part about it. You do have Wi-Fi and it's continual and there's no rolling Wi-Fi, no rolling data.
Okay.
and no Wi-Fi at the school, and then at the hospital it's pretty weak. I know I have Verizon, and they have I have a plan with them. Some people, I think, is it AT&T? Some of these providers actually give you free long distance while you're traveling.
Yeah, so AT&T has a day pass, which is $10 per day. After 10 days, the rest you get free for the whole month. So we have almost 14 days. So first 10 days, and then after that is free, which is included. So you can travel, and I mean that's how I do. I use the AT&T day pass because I need to make sure my connection is there all the time. Because also if we have the conferences, I use the data from the phone and be able to run the meeting that way, Zoom for people from here and there. So I need to have it everywhere. And of course, in case of emergency, I need to be able to call anybody and everybody I need. So I use the AT&T, and it has never failed me. So it works just fine. I'm able to call the same way like I'm calling from my house. So, but as I said, talk to your service providers and then ask them, do they have an international package? And then a lot of them have. The same thing with the bank. When you want to have an option that when you get to Tanzania to use your card, so then they can avoid that international fee. So your bank, if they have any international connection, then they will waive that. And then so when you go there, let's say you want to get maybe quickly money to an ATM and pull the money, you'll be able to do that without international fee. So talk to a bank. A lot of banks now are doing it. When we did like 4 years ago, the banks were none. So people have to carry cash around. And we know most of the time carrying actual cash is not safe. I mean, you can have a little bit, but most of the time it's not safe to carry cash all the time. If you have a card or you can transfer the money using all this cash up and whatever, you should be able to do that without any problem now. Okay, so for the fundraising part, so people have been doing, if you have an interest in any of the project, people have been saying, okay, I'm going to do the thermal regulation, so baby blankets, or I'm going to do the postpartum hemorrhage, or I'm going to do the school activity. So people have been doing individual projects and raise money that way, and we appreciate that part. We were able to buy quite a bit of things. And thank you for the group, like the whole Qhsc group, that they've worked so hard. When we post that we need something, people always come through, like the toothpaste, we were able to get for all the 830 kids, thank God. And then the toothpaste also. So we are happy with that part. And then the backpack, still continue raising money for that one. And then school notebook, I think Ms. Veronica is working on that one. So thank you. And then all the crayons and stuff, we bought those ones to send it to try and match it, but we're still raising money to be able to replenish those funds used to buy those items. And I know Bree had one of the fundraising that is the California pizza. This is just to help also the medical mission. And then the pizza is gonna be there on, let me see, May 16, which is this Thursday. So people in Florida, okay, we need to eat pizza from 11 to 7. This is one in the Wellington, that's close to the Wellington Mall. I mean, within Wellington Mall. This is the one that I'm going to send it to you. I said it's a long message. Oh, it's only 11 pages. It's a long message, but at least you know what is happening and when is the deadline and stuff like that. So when you're applying for the visa, like next month, yes, we're going to have like 2x2 passport size. That one, you're going to have to send it to, you take a picture of it and send it to the application. They're going to ask you. So you have to take an actual picture either on the drugstore or whatever, and then you have to take a picture of a picture. But we walk you through to get that. So, and then also you're going to have the invitation letter from the hospitals and then the application. So this is the website we're going to go and click on it, and we're going to walk you through it to apply for the visa. That's next month though. So don't worry about that part. The immunization. So the hepatitis A is because we were trying to prevent for food contamination, because we know the kitchen, I mean, this is anywhere else, even here in the United States, anybody can touch something that they should not be touching and touch your food. And then so we now make sure we are protected. The tetanus booster, that depends on your physician. We are not going to ask people to do that just because you're going to be walking. And that's why we say wear closed shoes versus sandals. If we're going out for dinner, yes. Or if we are at the hotel, you wear sandals, that's okay. But if we are going to work, like, or going to the safari, please protect your feet. Cover them up so you don't step on the wrong things. The anti-malaria, so there are different medications. So there's some doctors will ask you to take the medication a week before or 5 days before that. And then so all those guidelines, the doctors is going to give you options, because it also depends on what your medical background. So we're not going to know that, but your doctor should know that. And then so I always take the mefloquine, the 250 milligrams once a week. So I take a week before. So like in the 13th we are leaving, so I'm going to take on the 6th. And then I take the day that I'm traveling, and then every weekend I'm there, and then 4 weeks when I come back. That's just in case if the mosquito bit me. So, they're going to take a long time to incubate and cause malaria on me. So, but if I take that medication, it has been working for me very well all my life. I never had any issues. But there's some people who cannot do that part. So the doxycycline is 100 milligrams daily. There's some people who we have to take that part just because the way the doctor tells you, or there's another medical reason that we recommend that way. As I said, the COVID vaccine, that is recommended, is not mandatory, especially for people who are the healthcare workers. Okay, when you're taking to the doctor, this is the little screenshot usually we tell you. So for the malaria, you can get those medication. For the urinary tract infection, just because, remember, it's a hard place, and then we are working long hours in a sense that, like breaks in between, you have to go to use the restroom, you have to be hydrated and stuff. So it's evidence-based that they say people usually end up getting a lot of urinary tract infection. So to protect us, we take that as a prophylactic. So we're not taking it until you get sick. So you have it with you just in case if you start getting burning sensation when you go and urinate, then definitely take the medication to help yourself. But the doctor is going to be able to do that for you. And then also we take what they call travel diarrhea treatments. The doctor is going to order that medication, as I said, because whatever you are eating or you're drinking, we hope it's protected, but your stomach might not agree with it, or the type of the food that you are eating. You might end up having that diarrhea. Because remember, we start eating those different type of food when you are in a plane. And then so we do have that medication. So if you do, as far as I know, so far, only I think one person, for the 5 years we've been doing this, I think only one person had the stomach ache. And not sure that it was because of the food or just the person who was sick from something else. We don't know. But she was able to take the medication after a day of hydration and stuff, and then she got better. We do also take an anti-nausea medication. Sometimes the people with jet lag, they start feeling nauseated, or type of the food or type of the spices you eat. So just an all around, you can get Zofran. I've never had any issue with my doctor. I have written this medication, and thank God, even for now, I've never used any of those except the anti-malaria. That's it. But as I said, we take those up to prevent from getting sick. You might not need them. And then the Duolingo, there are just some examples here. Like my name is, those little phrases. like what Dr. Siakabe was saying, if you are talking to the kids or somebody in the hospital and you say even one word in Swahili, they'll be like so excited, and like they will be compliant of what you're telling them, and being excited that at least you respect them enough to try to learn the language. Those are just simple things, introductory responses, and that also is going to help you too, so you don't get stuck one place or another. Yeah, so more words, if you want to drink water or you're a guest or something like that, that's fine. Travel dates, we already know 13 and coming back, arriving the 14th and then coming back on the 28th, arriving on the 29th. And then the fees, we already discussed that. Oh, the ticket that we are buying, they always have to have free check-in bags. And we already encourage you that one bag is for your personal use, and then the other bag is if you can put the donations. So if you collect any donations or you don't have anything to put it in there, let us know so we can order stuff, and then you can help us ship it with us to Tanzania, so we don't have to pay the $200 for extra bag for those donations. As I said, I'm going to send you this information, so you don't have to read it too fast. I'm scrolling a little bit fast. So the travel medical insurance, I already put it information. That's the screenshot I had on the video there. If you click on it, you can see it. The currencies right now, $1 is approximately to 2,500 shillings. So your dollar is very valuable. So we encourage you to say probably if you want your personal money, at least $200 maybe with you. You may not even use them, but if you want to carry it with you. But majority of the people who have gone have not used much unless if they're doing shopping. So there was no need to like collecting so much money so you can go and use over there. So they've been just using a little bit here and there. And of course, as I said, your cards, they do have ATM, but there's those transaction fees. So ask your bank. A lot of credit card, also, if you tell them I'm going to be traveling from this time to this time, then they know that they're not going to charge you international fees if you are abroad, as long as you tell them ahead of time. And then so then you can use even your credit card. I do use a credit card just in case if we're at my place that maybe they require more cash to pay for either the food or the other expenses that needed to be paid at that moment. Then I usually use the card without any problem, and I've never had any issues. So, but I always notify my bank and my account to say I'll be traveling from this day to that day. Even passing through the Doha or Dubai or even Istanbul, I let them know that I'm going to be traveling. I'm going to stop here. I'm going to stop here, just in case if I'm doing any shopping in between or buying something in between, then I am able to pay with a credit card without the international fees. We already talked about electricity, and then accommodation. As I said, we share the location once we lock the rooms and stuff and knowing how many people are going. But it's called the Dimaj Hotel. You can Google if you want, that's fine. It's a nice place. And then the safari, we'll talk about that. Things to pack, as I said, more to it in the August meeting. So toiletries, towels, small towels. So everywhere you go, you are going to have a towel there, but some people usually have that. They want their own home tower, just a little bit smaller towers or something to carry with you. That's okay. You can do that. Bring sunglasses, definitely. It's going to be hot. Because remember, it's an equator. You have the little hat to protect your head, and sunscreen lotion, definitely. Extra batteries for charges for your phone. Because remember, we are leaving in the morning, come back in the evening. Remember, the electricity is different. Don't plug anywhere else because you're going to blow up your phone or your iPad or computer. So you always have to think that you have to have that the adapter to try and help you protect your devices. In the hotel, definitely, if you have your adapter, it's going to be, you can plug it in and then you are safe. Again, in the July and August meeting, they're going to share you the pictures of the chargers, and you can get that from Amazon. Even Walmart, they sell them, but the Amazon one also, they have, like different international areas that you can move around the little button to be able to use your devices without any problem. Some people have decided to pack dry snacks, like maybe they have graham crackers or something like that. If you do, that's fine. They do have lots of cookies, biscuits, and stuff like that. If you want to buy over there, that's fine. That's on your own. But some people always wants to have something back from home, so you can have that. You can have over-the-counter medication, the Motrin, Tylenol, those, Pepto-Bismol. Definitely, I always have Pepto-Bismol and Benadryl if you need. Sometimes maybe something itchy, you didn't know you have allergic to it or reaction to it, so there's something just to help you with that. But we do have sometimes the pharmacists near, like on our communication. So if there's any issues that we need to know something that we always have our doctors with us, and then if they have a recommendation, something that we can get. And now we have Mrs. Medi Akimbi. She can say, maybe try that one, try this one. So we can ask our pharmacy and then get us medication if we need to. But most of the time, you can get this over the counter here, just small amount to try and be help to alleviate any concern. And most of the time, if you have any issues that you can ask people around in the group, because I'm sure somebody have packed some of the stuff before you start buying other stuff. But if we find out that we don't have anything, then yeah, we do have a way of trying to find it. And I think the place that we are staying, the Marge, is close to the pharmacy close by. So it's a good thing that we can access as much as we can. You can carry a little small flashlight for emergencies, just in case if they lost power or something like that. You can have a little sweater or jacket, because sometimes it gets colder, especially if you're doing the flight, because it's 14, 15 hours flight. The air conditioning sometimes is too much. Have the little jacket. The same thing in Tanzania, you can have that small jacket or light jacket, because sometimes if you're traveling, it's an open window, it might be your draft is too much, or you're going in the evening, it's a little cooler, then you might need a little jacket. I know last year when in the evening, one of the nights, it was cold and everybody was like, what is this? We thought Tanzania is going to be hot, but well, I can't predict the weather. Sometimes it gets a little bit cooler. So the light jacket might be helpful, your sweater or the hoodies, that'll be fine also. You can have that with you. We usually have, some people use travel pillows to help with their neck. That would also be good. And then you can have those, we have those like emergency ponchos for, like we buy them from Walmart. Like I think it's like $1 or $2. Something that you cover yourself. If it rains, then you cover. So instead of like carrying the actual umbrella, because then once the rain stops, where are you going to put it? But the little ponchos, those little plastic rain covers, yeah, you put it on, you can fold it and put on your bag. That's fine. And then you can buy stuff from Tanzania if you want to, that's okay. I think that's the end of, yeah. Okay, I know it's a lot of information, but we're gonna continue sharing the information to make sure everybody understand. Any questions? Hi, Miss Mary.
Did we show the Etsy shop?
Oh, Bree, are you ready?
You told me the link for the pizza.
No, yes, start with the pizza first. Yeah, so
Okay. Hold on. Can I share my screen?
Yes.
Okay. Can you guys see that?
Yes, we can see it.
Okay. So, as Dr. Gabone said, next Thursday, we're doing a fundraiser with California Pizza Kitchen. So from 9 in the morning to, I believe, 10 o'clock at night, you guys can go there and buy whatever. It doesn't have to be pizza. And 20% of whatever you buy, 20% of it gets profited back to Qhsc. And this is just a website. You can order ahead online, and as long as you say we're with the Qhsc organization, they'll know, and then that's when the 20% profit goes. Any questions?
No. Thank you.
Okay. How do I stop sharing?
Underneath.
Okay, I got it.
Okay, so while we are talking, just find find the Etsy where we're discussing right now. So any other questions? Oh, thank you, Veronica. I heard that.
So we also have an Etsy shop where we make t-shirts with the Qhsc logo on it. So if you go, many of you probably know what Etsy is, but if you go to etsy.com in your Google search engine or whatever you guys have, Firefox, you can put QHSC in the Etsy search bar, and you'll start seeing our products. And if you click one of them, you'll see the price. You can select different sizes and often different colors. This one just comes in the yellow though. I don't think it has another color. And if you scroll all the way down, you'll see our link here, Dr. Gabon QHSC gift shop, and I can post the actual link so it brings you directly to just our products in the group after the meeting. But if you click on it, it shows all of our products. So we have little baby clothes for those of you who have little ones, dog clothes. And if you guys want something special, if for some reason you want QHSC underwear, I can make it.
No, but where is the dog thing? That
You
is
want the dog
cutest
thing?
Yeah, that is the cutest
All
thing.
right. Hold on. And then this
the
is
one-
not my dog, but it's super cute. And it
I
comes in
know.
different colors too.
I
So,
know.
yeah. We have hats. We have I know Dr. Gabone and Dr. Siakabe love the little fanny pack. So we
Oh,
have a
where's the
lot of
funny
cute.
pack? Show them the funny pack.
We have the little bags. Here's the hat. And then here's a
Yes.
little fanny pack. And this was very helpful last year. So you guys, even if it's not this one, do want to bring a fanny pack, because even if you're going to the school and not the hospital, you always want to carry your passport or at least a copy of your passport around just in case.
Yeah, definitely. Thank you, Bri, for mentioning that. But yeah, so the funny pack, you're going to have those important documents with you all the time, because, you know, we are in foreign country. So your safety, your identification, you have to have them all the time. So passport is one of them. And then, you know, like important documents, I don't know, little money here and there, and contact information, place that you can put your cell phone. So you wear that even if you have scrubs or you have your regular clothes for school, you always have to have the fanny pack with you all the time. You have to have, you know, like the gloves, you can put it in there, some toilet paper, because my hand goes somewhere else, you might not have the toilet paper. So we do, sometimes we encourage to buy those, what do you call the disposable wipes?
Yeah, like little disposable wipes.
So then at least you're able to wash your hands and wipe yourself, because sometimes not all the toilets have the flushable thing. So sometimes it might be those, you have to squat, so your knees have to be strong. So, but yeah, so you can use those little disposable wipes to protect yourself and clean yourself up. Especially if you are going to the national park or the, here you go to safari, but this is an actual the home of these animals. So the toilet might not be the flush, unless the place that we are sleeping in, then that's the fancy one. But on route, if you are resting place when you are going through it, because remember, you're going to be the whole day. So we leave in the morning, go around, you see where the animals are. They might say the lion is on the left side. Everybody's going to go on the left side and wait there. And then you eat lunch over there and rest a little bit, and then go somewhere else around in the evening, and then rest a little bit, and then go to see the animals in the evening. Because sometimes if it's too hot, they move away. They go to the greenery place, and then when it's evening, they come back. So then we might be going around and around to try and find as many animals as we can. And then, so those are the times that you might be using the restroom that they don't have the flush, is just the horn underneath. So having those little things with your little fanny pack is going to help to protect. So you don't have like extra bags and stuff, because they're going to add weight to you. We always provide water, so you don't have to like carry extra water, because it's going to be on our the travel guide truck with us. So they're going to keep it cold, because remember, it's going to be hot. So we try to minimize extra stuff. I mean, it might have a little sweaters, but you can leave it in the car. That's fine. Because if in the car, the car is driving too fast, you might get cold. So, but like what Dr. Siakabe says, looks like an Indiana Jones. You're protected everywhere else. Wear pants, please. No shorts and stuff, because those little mosquitoes are going to bite the bare skin, and we don't want you to start itching yourself throughout instead of enjoying this moment. And then, of course, make sure your cell phone or camera have more space, because you're going to need to take a lot of pictures. Yes, it's going to be fun.
Oh, Dr. Gabone,
Yes,
did you mention, I walked away for a second, did you mention the charger thingy?
yes,
Because we have a lot of new people. Okay.
yes.
Oh.
And I'm gonna ask Dr. Siakabe post it on the website, on the group. So that Amazon, as I said, we have the Amazon, it has different countries in there, so yeah.
Okay.
Because we don't want people to start saying, oops, my iPad is gone. Yeah, that's not good. We don't want to do that, yes. Mhm. Anything else? But so we do have a testimonial from one of our volunteer. So he's gonna share with us.
Yeah, I'm gonna share this was from 2021. I'll share a video first from 2021 because there was a question asked to about like what time are we working and stuff like that. So many times we do actually work in the evening as well, organizing and sorting stuff and stuff like that. So this year for 2021, the one that I'm going to show you, we were fortunate because we were able to have a nice rooftop location at the hotel, which hadn't been fully developed yet into a restaurant. So we were able to use that rooftop location. And I'm just going to show a quick clip of that one. So that one we were fortunate, but it just shows you how we actually have to work sometimes too to organize the stuff, the supplies and everything that we're giving out. So. I don't make my deal. I just need to know.
So we have those backpack for the kids, and you can see the pencils and stuff. So each bag, and those are the notebook. Each bag receive a notebook, the 5 or 6 pencils, the crayons, razors, and something else. You can see Mr. Steve Jones and Dr. Siakabe and other people's there. You can see the rooftop. You can see a beautiful view there, but we have to work first.
All right, I'll stop it there.
So when we arrive on the 14th, that's Saturday, we're gonna rest a little bit. And then in the evening, that's when we start sorting stuff out. Because remember, on the shipment, they staff all the stuff just to try and occupy the space. But when we get there on Saturday evening, we're gonna have to sort it up, like this stuff for school, this is stuff for the hospital, this stuff for the community. Okay, for the hospital, this is for the thermoregulation, this is for postpartum hemorrhage. We have to sort them out that way. The same thing for school. This is for the backpack, goes to the backpack. This goes to the vision. This goes to the nutrition. So we have to sort them out. So in the next, when you start morning to go to the other school or the hospital, we just say, okay, today we're going to do the backpack. So all the backpack loaded on the shuttle, and then we go, because we're not going to start sorting stuff at the school or at the hospital. No, we have to have those done. When we finish, then we start having fun. Yes, sorry, you ready?
Yes. All right. So this is an interview that we did on Miss Sandy Knight from the medical mission in 2021. This was the last year, and we prayed on this one that we had. I'm not sure if everybody's familiar with the term, kind of like voluntourism. So there might be a person or two who may come and they figure, well, I'll just jump in and I can go hang out and see the sights and everything like that, but they don't understand that we're on a medical mission and that we're there to work. So, but Miss Knight was there with us, and she was a very mature, very professional person, and she kind of was a really good addition to the team for that medical mission. She's still around. She hasn't gone back yet. But she does help out. So I'll just roll a little bit of the clip there. And the person at the bottom of the screen there, that's our secretary, Valentine Dantes. She's also from Florida as well.
Same thing here. When you had mentioned you went in with no expectations and going into a different country from the United States, of course, how I want to say kind of spoiled we are here. I had the good fortune of, I traveled to Costa Rica quite a bit, so I got to experience missing things or our luxury comforts. So going with this gang, I had mentioned before I went in as an individual, I did meet Parag and Dr. Gabone briefly. It was a Friday the 13th, if you believe in all that good luck stuff. So I wasn't quite sure. I'm not I don't have nursing. I've been in administration all my life, and I feel as far as like human connections, I always try to have a nice time or be a support system for people, whether it's the people that are actually the mission team or the people in the country. As I said to Parag before, I felt like I went in and they gave me, I came home with way more than I felt like I gave them, because I never felt sad. I never felt like I felt sorry for them. They were joyful. They were singing. They were laughing. They were dancing. And I got to spend a lot of the first week at the school. So we were with those kids, and it was just a wild ride. And they were happy, and they were playing. And I was fortunate enough to help with Dr. Vanessa, who did the eye screenings, the vision screenings. So basically, I got to see individually almost every child that was there, and just watching them and seeing the different personalities as little individuals, and then as a group when they were running around and standing in line for their lunch, or we'd sit out and just sit on the step and just watch them run around, and they were just as fascinated with us as we were with them. And Dr. Guboni, the last day we were there, I was just a mess. I was crying. I was like, I don't want to leave them. It was just such a joyful, fun environment. And then after my first week there, the second week, I did ask if I could go to the hospital, because the group that I met, the mission workers, Qhsc and Bree and Hunter and Marcella, and I called the sisters, and then we had sports girls. I called everybody sort of nicknames. We would sit at dinner and we would trade stories about our days. And I was like, I really like to go to the hospital. And I got to see newborn babies, and I got to go with a small group, and we were giving the moms blankets and hats and things. And I got to bundle up a baby and be silly and hold a baby. And it was just, I got a very well-rounded experience, because I was put in as administration with the school, but then I was blessed enough to request going to the hospital, and I got to spend a few days there and watch a few of the nursing student girls give presentations on the keeping the babies warm and postpartum. And Bree Vargas gave a presentation. I was very impressed by these young students on the mission team. So I got to cover a lot of bases. It was just amazing. The conversation with the group at the end of the day was amazing. We were all tired, exchanging information.
So I said it depends on individuals, but I hope that whatever your interest is, and then the area that you're passionate in, so you'll be able to get to fulfill that by offering your services, your support to these groups. Because we want to make sure, yes, you are helping the organization, yes, you are helping this individual that we are going to touch, but also I hope your life will be blessed enough for the sacrifice you're going to do for us. And then so you get rewarded for your time and effort when you're being there in Tanzania. And then we get to show you the fun side after working hard. And so when you come back, you have more stories to share. Okay, so any other question for you guys, for the new people? Anybody who has a question? Because remember, if you have a question that you don't ask, probably somebody else has a question, but they're afraid to ask. But I'm always so happy to hear the question, so then I know if are you getting information or not. Yes, Ms. Rosen.
We're volunteering on the second week. We're volunteering the Monday through Thursday, and we're leaving when the 28th is that Saturday. So what are our plans for that Friday, Saturday? Or that's a secret too?
No, it's
okay.
No, it's not. So yes, the second week, Monday through Thursday, that's working days. So then Friday, usually we say like an off day. So those are the days that we say we send you guys shopping around the city to try and see what we need to do. Just having, and some people just wants to lay down and relax, which is fine. So we get to who wants to do what on that day, and then we arrange you with the people from Tanzania, our other global volunteers who you've worked with those 2 weeks to say, okay, I'm gonna go to like a carrier call, your marketplace. I'm gonna go to do maybe shopping somewhere here. So we put you guys in groups, and then we have somebody just to walk around and make sure you come back safely. Right. So the Friday is kind of like like a low down day, but people once used to go around and shopping and stuff.
Saturday we leave.
And Saturday we leave, yes.
Okay, so Friday. Okay.
Yeah.
Thank you.
I do have a question. Okay. So when it comes to the scrubs, so are we always going to wear the tees from your organization? Yes, right? The t-shirts?
Yes, so we try to make sure that everybody looks the same or similar. Yes. So during the day, definitely we want you to wear a t-shirt. So the organization is going to give you one t-shirt.
Okay, that's what I
for
want to
free.
know.
And then, so you can buy your own to add, as I said,
Perfect.
in the meantime,
And how many scrub bottoms do you think we would need? I mean, I was trying to gauge, like, how many do you guys take? Like, that's sufficient enough to be able to change and, feel
So
comfortable
because we have 4 days, so I would say at least 4 bottoms. But you can get more if you want. Some people, they said you can wear Monday, Tuesday, and then you wash it, and then Wednesday, Thursday, you wash it, and then so at least 4. If you get more, and usually when you're packing, you roll it, so it's
that's what I'm gonna do.
Yes.
Thank
So
you. Okay.
Yeah, so for the hospital also, people can wear like a full scrubs, but you have your badge because it's one color, as long as it matches. So then we have the badge. Everybody's gonna get the ID badge. Oh, I think mine is somewhere in the house. But everybody's gonna have an ID badge with you. So because the ID badge helps you to identify who you are and where which group you are with, and then just to put your credentials. So most of the time we just say global volunteers in your name, and then either community or healthcare staff. So at least everybody has the identification with them all the time. Yes.
Okay, thank you so much.
Hi. You know that I'm with another group, and as is Dr. Gwen Randall. We're both with T. Roy Jefferson Medical Society. It's a group of minority professionals who do good things in the community. Predominantly, we mentor, but one of our main activities is a health fair. It's a back to school health fair.
Okay.
And we have different rooms. So other organizations participate with us. I know you're sometimes looking for community activities. This would be a Palm Beach County residents community. I mean, anyone can come, but who would fly in from New York to do a one-day health fair?
Well, they can come.
So you're welcome to come. But your CPR group, and I have to give you kudos. We did a great job with that CPR group at my church, and it would be a similar setup. You bring your Qhsc t-shirts and set up your mannequins, and what you'd be doing is teaching community people to do CPR. We usually get, golly, I'm going to say maybe we get a lot of kids coming in for their physical exams. Of course, they come in with their parents and grandparents. They all need to know CPR. CPR is, in my sudden death in athletes activity, CPR was considered number 1 because you're there, Johnny, on the spot. It's not the defibrillator, it's the CPR. So if you could teach people the CPR with your mannequins. I talked to Dr. Her name is Dr. Flora Bensi. She's a dentist. She's delightful. Her background is Ghanaian. She's excited to have you come. Again, you don't pretend like you're T. Roy Jefferson. Come with your Qhsc banners and that sort of thing, and set up in a room. The room may not be as big as a church. You're welcome to come the day before, or early, and see what the room looks like and how many volunteers. As many as you need. Overflow volunteers may do things if they want, like blood pressures, because it is a community health fair. So you're welcome. Let us know what you want to do, because you got to get that room. That spot has to be given to you. Okay.
Yeah, no, we want it.
Okay, you want it. You're gonna love Flora.
Yes, no, definitely. Give me more details if we need to get some, and then we can make a little flyer. So July 27th.
Flyer. Okay, or you can make your own flyer like we did before. Okay.
Okay,
well,
no, that's fine. Yeah, definitely give us more details. And Bree already said she would do it.
Okay. I didn't mention it's at the Max Fisher Boys and Girls Club, which is in Riviera Beach. It's on 13th Street. It's a beautiful promenade that leads right down to the the little sea area that, where you do your ski-doos and go to Peanut Island. So it's a lovely area, and you can even incorporate that. There's a tiki hut, which is a, eating place on the beach there. So it's a fun, yeah, it can turn into fun.
Okay. You said what time? What's the time?
From 9 a.m. to 2 p.m. And I'll send you the flyer. I have, I can send you a flyer. I couldn't access it at this time. Okay.
No, that's fine. Sounds good. Thank you. We do want those community outreach. So we can also help people in our community here and the global community. So definitely that would be a blessing if we can go and do it. In the area we know, the better we get to recruit people who can come and help. And definitely we make a trip before then just to see how big the space is, so we know how many people we can get and the layout and stuff. We do have the mannequin, we do have the stuff like that. So that'll be good.
Okay, good.
Thank you very much, Dr. Sharon.
Welcome.
Dr. Siakabe? I mean, there's a lot of stuff during those 2 weeks. Yes, we work 4 days and 3 days off, and then 4 days and then 1 day shopping, and then we come back. But with those also 4 days either before, 4 days the second week, we try to do at least 2 outings. Means like we go out to the normal regular restaurant, so you guys can see also in Tanzania how the restaurant looks like, or what services they provide. So we have those stuff, and then sometimes we have like a catered food. So all the preference people have, I mean, we notice around when you say, oh, we love this, we love this, so we always try to find somewhere else where they can cook that just for us. And then so we go outside. So we always ask you to have at least 2 outfits, decent outfits that you can wear outside. And then when we go and have a normal outing in Tanzania, that has nothing to do with like either the food at school or the food at the hospital or the food at the hotel. So we usually have those 2 outings. So those are on top of going to the safari. Because the safari usually people likes that, like because it's like an outside, it's just a free day and come out and enjoy your days. Yes. Yes, Audrey.
Totally forgot about the pad project I was talking about. Okay, so I ordered the pads, and this is what it looks like, a small pouch like this. They have 10 of, okay, these are reusable pads, and you wash them, and they're very good. My daughters, I didn't even realize both of my daughters use them. And one of my daughters has a set she's had for 4 years. And this is what they look. This is the pouch. It's so tiny, really good. 10 comes in a pouch. So this is what it looks like. It has a snap, right? And then this is the other side. So it's black. So it comes in a very large one. Well, this is the medium size. It comes in a large. This is for heavy days, nighttime. And these are beautiful patterns as well.
Wow.
And then they have a small one like this. So I wanted to do some sort of project to fundraise for enough for each, so each girl could get each size. I totally forgot about this. Yeah, so
you're gonna make me cry now.
Oh, don't cry.
No, there's tears for joy, because these girls, you will see these girls. Oh my goodness.
Yeah, and my daughters dry it. They say it dries easily by the next day. It doesn't take a long time to dry. So, and it's really easy to use. So like I said, one of my daughters has been using a set for like 4 years. So, and they don't deteriorate. So it's really good. And it has some sort of, I think, carbon in there. So it absorbs a lot. Yeah. So
wow.
I'm thinking of, so maybe, I don't know how to do the fundraising piece, but if we don't get enough for the fundraising, I'm willing to donate the rest, whatever.
Are the sets, or do they sell them in packs?
It's the entire pack like this. It came with 10 pieces, and each color has, I think, 3. Each pattern has 3, well, it has an extra one, of course, but this is the pack, and it's so tiny. I mean, how many can we fit in this? A thing of a suitcase. So
so how much are those 10?
Okay, I just had, well, for the pack it was $24.99. For me, that's I think that's reasonable since they're gonna last forever. So yeah, $24.99.
So $24.99 you get 10.
It's like $2.40 or something like that.
Yes.
Right. So
So $2.50, just for the so $2.50.
Right, but they have others too. This may not be the optimal brand. I'm gonna ask my daughter which brand she had for the $4. So I mean for the 4 years. So I'll see what brand that is. But they seem, I looked at the reviews on Amazon. They're made by Teamoy. I don't know if you guys can see that. Teamoy. Teamoy.
Yeah,
And
we can see it.
they're really good. They're really when you touch them, they're like durable, you know, really nice material, satiny. So you're not gonna get a lot of uncomfortable feeling. There's not any plastic or anything like that, and it snaps. So really, really good. Yeah, I was just wondering, how do we teach them to hang them, like when they wash it? But they have to wash other things, like they're yeah, like do we need to provide those pins?
They
Or
have the pins to.
they have it.
Oh.
Okay.
No, I mean,
Right.
usually they have, but if we can get the pins, I mean,
That
so
would be good too, right?
I did a math very quickly.
Yeah, I did
So-
also. So what did you come up with?
So, I mean, for $2.50 each,
Mhm.
so in order to get for this one for each child, it's gonna be, I mean, $550. So for one for each child, but we need
That's
to
it?
have
I thought it would
three.
be more. That's perfect.
No, so just
Okay.
for one, for those 220, but you said, I mean, at least they need to wash it. So we need at least three for each. So 1,500 could be, we get
Yeah.
each child three of them. So we need to
Yeah,
get
that's
to
very
start that.
good.
We need to work on
Yeah,
that.
that would be perfect. Okay. That's I totally forgot. I'm sorry. It's
No,
early.
no, this is, it's great news. That is great
Good,
news.
good, good. Yeah. Okay.
Morning, everyone. I am on the call. I just muted myself so that background noise won't interrupt. But I went ahead and checked Amazon and I found what Audrey is talking about, so I sent the link. Hi, Audrey. Thank you.
We need to
Yeah,
have,
I'll donate some money.
yes. So we need some, because if we can get at least 1,500, every girl will get three of them.
Yes.
Yes,
A
because they
big
need to be
pack.
able to wear one, wash one, while the other one is drying, so they
That's
can use
right.
like instead of like
Mhm.
not having one. Yes.
That's right.
Oh
And
my
then
goodness, thank you.
You're welcome.
Yes. So maybe when we finish the meeting and the discussion, and people who wants to donate, please they can stay behind, and then we can get. I wish I had the anybody using Zelle. I mean, if they want to send the money through Zelle, that's fine. Anybody wants to send it through Venmo, that's fine. Because that will help. We need to send we need to order them today, so they arrive on Monday or Tuesday latest, and then Veronica's staff can go the package. Yeah, because if we buy almost 220 package, that's going to be quite a bit.
You share your Zelle information.
Yes, that's my.
And then when you went later on after the meeting.
Yes, so the Zelle is, yeah, the Zelle is my phone number. So, but yeah, I can share, or I can put it on chat. Let me see.
It's going to be in the WhatsApp chat?
Yeah, I can put it on the WhatsApp chat or the group chat. Yes.
Okay.
I can put the QR code for the Venmo and the Cash App if you want to.
Oh, you do have them, yeah?
Yeah.
Yeah, can you put them in the group too, Bree, in the WhatsApp?
Yes. Yes.
Okay, I just sent my link to the Dr. Gaboni to your WhatsApp. And when you click on that link, what price do you get?
Oh, I get the $24.99.
Oh, so that's the proper one. Okay, good. So it's $24.99. Good. It's
Yes.
not a discount. Yeah.
I think it's also because a Prime member. I'm a Prime member too.
Oh, that's the Prime. Okay.
You use the Zelle is my phone number.
Okay.
And then Venmo. You post it in the group. Thank you.
Mm-hmm. I'm putting your phone number in there, Dr. Gabone, for the Zelle for people who want a Zelle.
Yes, thank you. Yes, no, thank you very much. That definitely will help. And then if we can send it to Veronica, that will definitely help. Because these girls, you see them, they're so humble, they're so eager to learn, but missing 5 days a month, every month, is not fair for them. How are they gonna catch up? They will never catch up. So, but anyway, I think this has been very helpful meeting. So any other questions?
Okay, hello everyone, much greetings from Bukoba, Tanzania.
Yes, we can't wait to see you. She's gonna come and work with us. Huh?
Yes, and I would like to participate in helping in Swahili English as an interpreter.
Yes, you're gonna help us. We're gonna put you to work.
Yes.
Yeah, I'm gonna add you to the groups. Yes, definitely. Yeah.
Yes.
Okay, guys. I think what
Yes.
I prepared for you guys today, that's it. And thank you very much for everybody who came and participate. Without you, oh, we're not going to be able to do anything. So thank you. And anybody who is going to donate for the pads, I mean, definitely reusable pads, we really need your help so we can order them. Because I think it says order within 7 hours to be able to get it shipped and arrive on the 11th, so 13th, so which is Monday. But we want to make sure by Tuesday she gets them, just in case if Monday is late. So we need your help. We need at least 1,500 to be able to get these girls at least 3 pad each. Yeah. But I mean, we're gonna take whatever we get, but at least we need 1,500 that will help to buy these pads for these girls. And then so thank you again. So
Thank
that'll
you.
be helpful. Thank you very much. We appreciate that.
Okay, no problem.
Yes. Okay, any other questions for everybody else? Please, when you have ideas like that, please jump in and help. We welcome your assistant because we all have the same goal, just to pay forward. That's it.
Yes.
We're blessed enough to a point that we can help others. So the more we bless others, the more we will be blessed. So, and I thank you guys for your time and have a blessed Saturday and the rest of the week.
You also. Nice meeting everyone.
Yes.
Thank you. Nice
Karibu sana, Daktari Agape.
Yes, Miss
Asante,
Tanya.
asante sana.
Asante sana. Have a good morning.
Yes.
Have a good day, everyone.
I gotta meet Bill.
Yes.
So Bill's here.
Oh,
He just
Bill,
got
where's
back.
Bill?
Practice, yes.
He just got
Sorry, I
back.
couldn't hear you clearly.
What's going on,
Hello.
man?
Doing
Yeah,
good,
it's,
doing good. How about
yeah,
you?
it's all good.
I'm all right.
I'm hoping,
Good, good,
hoping
good.
like by the time you come for
Yeah, I just
the
got back.
things on the field, then I'll be able to probably share much. Today I was just acclimatizing and getting to know all that is happening. So I was happy to get information and yeah.
Yes, we continue sharing with you and more. I'm gonna contact you. We have more online training, I think, next week. So we're gonna
Sure.
get you.
Sure. Thank you. Thank you very much.
Yes, Mr. Bill. Yes, thank you very much.
Yeah, Bill, we're gonna catch up, brother.
Yeah, we need to. We need to.
Have a good day.
Thank
God
you,
bless.
guys. Thank you. Thank you. Yeah. Okay. Bye, guys.
Bye-bye. Thank you, everybody. Peace and blessings.
Qhsc